The Committee on Health, Education, Labor, and Pensions will please come to order. Today we're holding our fourth hearing this Congress on drug pricing, and we'll hear from Health and Human Services Secretary Alex Azar on President Trump's blueprint to reduce the cost of prescription drugs. This is the first hearing on the administration's blueprint. Senator Murray and I will each have an opening statement. Then I'll introduce the Secretary. I welcome him. I encourage him to take the time he needs. He's the only witness today, so if he needs a few extra minutes to explain the blueprint, he's welcome to do that. Then each senator will have 5 minutes to ask questions. The Secretary must leave at noon, so I'm going to be a little strict on the 5-minute limit, and if senators ask their question with 2 seconds remaining, I'll ask the Secretary to provide the answer in writing so every senator can have a chance to ask questions. On May 11, President Trump announced a comprehensive blueprint to reduce the cost Americans pay for their prescription drugs. And today, we're pleased to hear from Secretary Azar to help us understand that blueprint, what the administration itself can do to implement it, and what legislation might be necessary to help you implement it. Hearing Secretary Perdue talk about farm issues is helpful, I think, because of his background as a family farmer and as a veterinarian. And most of us think Dr. Scott Gottlieb's background in business and service in the Bush administration has made him a more effective head of the Food and Drug Administration. In the same way, I believe it's helpful that Secretary Azar also knows these issues well. He was Deputy Secretary and General Counsel at the Department of Human Services in the Bush administration, and he was an executive with significant responsibilities at a pharmaceutical company. One of the things we've learned during our first 3 hearings on drug prices is that the amount we spend on prescription drugs can vary widely from year to year. Sometimes the amount we spend on drugs grows by as little as 1.3% over the previous year, as in 2016. In other years, by as much as 12.4%, as in 2014, according to the Centers for Medicare and Medicaid Services. But we also know that according to CMS, spending on prescription drugs is expected to grow at an average of 6.3% a year between 2017 and 2026, faster than hospital stays, doctor's visits, or any other healthcare sector. At our hearings, we've also learned it's difficult to track the billions of dollars Americans spend each year on prescription drugs, which in 2015 was $457 billion, according to the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services. We learned that one of the reasons tracking where the money goes is difficult is the use of rebates to reduce list prices, which is when a pharmacy benefit manager negotiates a discount on a drug with the manufacturer. We also learned that while the $457 billion we spent on drugs in 2015 is a big dollar amount, drug spending is only about 6.7% of what we spend overall on health care in America, according to the Assistant Secretary for Planning and Evaluation. And that number includes not only drugs purchased at the pharmacy, but also drugs given in hospital settings. The administration is taking action for the same reason we held our hearings. We all know many Americans struggle to afford their prescriptions. According to Kaiser Family Foundation, about half of Americans, 160 million people, take a prescription drug. And about 1 in 8 say it's difficult to afford those prescriptions. But when we talk about the cost of prescription drugs, we have to keep in mind what we've learned in other of our hearings, which is we're living in a time of remarkable biomedical research that's leading to new and life-saving drugs. These miracle drugs may take billions of dollars and several years to develop, and so they may be very expensive. For example, we now have drugs that can cure hepatitis C. These are expensive drugs up front, but curing a patient with a one-time treatment can be significantly less expensive than treating someone with hepatitis C over the course of his or her life. In addition to our 3 hearings, this committee has taken some steps already to reduce drug prices. In the 21st Century Cures Act, we included provisions to cut the red tape at the Food and Drug Administration to increase competition as a way to bring down drug prices. And in the FDA user fee agreements that this committee worked on and the President signed in August, was a provision from Senators Collins, McCaskill, and Cotton to improve generic drug competition. And in the blueprint, there are some steps the administration has started to take already or is intending to take. For example, FDA is going to start going after bad actors gaming the system to delay generics from going to market. This is a place where Secretary Azar can use the bully pulpit. Dr. Gottlieb has already released a list of companies blocking access to their drugs and delaying generics coming to market, shining light on the questionable behavior of these companies. Another action FDA is considering is requiring drug manufacturers to include the list price of a drug in television commercials or other advertising materials. The blueprint also proposes ending the so-called gag rule that prevents a pharmacist from telling a patient a drug would be cheaper if paid out of pocket instead of with insurance. The administration has proposed ending this rule on federal plans such as Medicare Part D. Senators Collins, Cassidy, Smith, and others have a bill to end the rule on all insurance plans that this committee hopes to consider later this year. I also want to hear specifically how Congress can help reduce drug prices. At our previous hearings, I questioned the need for rebates because they make it difficult to track where the money goes. And I understand the administration may need some additional authority to modify or end the use of rebates to increase transparency. These are a few of the proposals in the blueprint, and I look forward to hearing from Secretary Azar about others. Senator Murray.
Well, thank you, Mr. Chairman.